All
Welcome
right.
everyone. Thank you for joining this session. On the occasion of World Mental Health Day, we took this opportunity to have a little chat, conversation about the link between cosmetic surgery and mental health. Um, so Dr. Karan is a board certified plastic surgeon, reconstructive surgeon, and has worked with various plastic surgeons globally. Now he's working at Tara Healthcare, where he's uh, providing the highest level of standards in treating his patients, especially in body contouring and facial rejuvenation. So,
Hi.
Dr. Karan, how would you like to take this up?
Hi. Thank you. Firstly, thank you, Bhuvana. Thank you, Inspiron, for having me today on Mental Health Day. It is such an important day. Um so we thought we would use this opportunity today to kind of talk about something which we in our practice uh, keep it on the highest level in terms of understanding how the journey of anything of a procedure or anything will happen, uh, because of which we thought today we'll talk about cosmetic surgery and how it impacts uh, your before surgery, after surgery, during the surgery. And I thought, who better than you and Inspiron to kind of chime in, have a simple discussion, um, to understand things better, to make people who see it live and for people who see it in the future, if they ever get a procedure done, so that they have at least one aspect of this, of the entire gamut of things covered, and it helps them. So thank you, Bhuvana, who I'm so happy that you're here. Bhuvana Prakash is an MD psychiatrist who studied from KMC Manipal. Uh, so she has done extensive training with psychiatrists across India. She specializes in conditions like depression, anxiety, ADHD, along with the psychosocial approach to treatment. So I'm very excited and very happy that you're here, and Inspiron as a whole. And thank you to Priyanka as well, who heads Inspiron, for helping us out every time and helping us and people watching understand something better. So let's start.
All right. So, how do we um, where do we make the link between cosmetic surgery and mental health, and what has been your experience throughout your practice, and how much you've had to come across a lot of patients with psychiatric problems, and how have you had to deal with it?
Yes. So a lot of the times, uh, when let's talk about first assessment of a person for any procedure. Now, when we talk about a procedure, it can be not only cosmetic surgery, or it can be any elective surgery. And this is where we try to understand if the person who wants to undergo a cosmetic procedure uh, is ready to do it or not. So there are certain ways that we kind of figure out if they are ready for it. We have to rule out things like body dysmorphia. We have to understand if the person who wants to undergo the procedure has realistic expectations from the procedure. So the entire procedure is a journey from start to end. It's not only the destination that has to be good, the journey has to be good as well. So if your journey, in that journey, if your mental health, I think the mental health is the most important part of your journey towards the destination. And if during that time your mental health is not at par, that is when you start blaming either the doctor, or blaming someone else who made you do it, or you start blaming things. So it's very important for us that the entire journey is safe, which is why we kind of try to understand the person, understand where they are personally, professionally, in their lives, which also impacts their mental health, and also bigger problems like body dysmorphia, which is a big red flag, because we know that a person with body dysmorphia will not be happy irrespective of the success we have with the procedure. We will have a certain amount of success with the procedure, but the patient is not going to be happy, which is where I think, Bhuvana, you can shed some light into what body dysmorphia is and how we can
Yeah.
assess, or how we can this. Go ahead.
Right. So, to all those people attending and who are new to the word body dysmorphia, it is a condition that normally affects females more than males, and the prevalence is about 2% or so. What happens is that they have one part of the body that they don't like, and they're very preoccupied by it. They're so preoccupied, they just do not like that part. They want to, they're repetitively, using ways and tactics to hide that part of their body, or they're standing in front of the mirror all the time, and so preoccupied by that to an extent where they're not able to function or do their day-to-day activities and chores. So the thing is that unfortunately, if they do try to rectify that, and even if it is rectified, after that they start having problem with something else. So it's almost like a preoccupation. That's why it's now, as per the new guidelines, is falling under obsessive compulsive domain of the disorder. So it's very distressing for the patient. And if they don't have the insight or are not aware that this is actually a condition, then it becomes more difficult for them. So I think it's very important to rule that out and have a conversation and do a psychological testing of the patient right before the treatment. So, Dr. Karan, have you had the opportunity of doing any psychological testing or anything else that you do right before the procedure? What are the red flags that you see? One is the body dysmorphia.
Yes. So, so there are. I mean, there are no. Most of our questions are very objective to kind of understand where the patient is at. We see one is their age maturity. Uh, we see if they are behaving in a certain way which is not in accordance to their age. That is one way of telling if that person is able to cope with the procedure post-op. Their age maturity, which means if is the patient 30 but acting like a 15-year-old.
Hmm.
That
Right.
is one way. That is one way I assess. Then there's also where we see if this patient has realistic or unrealistic expectations. So
Hmm.
expectations, marking expectations before any procedure is very important. We cannot have a person who comes to us for, say, rhinoplasty, say a South Indian nose, or a Northeast Indian nose, which is generally flatter in front. And if they show me a picture of, say, one of the Kardashians or one Caucasian supermodel, and say this is the kind of nose I want or the face I want, it's very important for us to draw a line there and say we are ethnically different from what you're showing us. We
Exactly.
can do our best to improve the results. But if you start from, say, a 1 or 2 out of 10, you cannot suddenly jump to a 10 out of 10. All we can do is we can improve to, say, a 7 or a 8. So, drawing boundaries and having realistic expectations is one more way of doing things. Then, trying to, there's also this thing that, some people try to solve their relationship problems through a cosmetic procedure. So sometimes, say, a wife or a girlfriend comes to have a breast augmentation or a vaginal tightening or something like that, or a buttock enlargement, and they think that their relationship with their boyfriend, their partner, or their husband will improve after that, or will become perfectly all right after that, which, I mean, most of the time that's not what the reason is. So we have to understand that if they also have some things like an underlying depression or anxiety, that is something that we have to
Yes.
also. So these are the small, and also some people come with very minor problems, very minor problems. Sometimes it's difficult for us also to kind of see the problem. So if the problem is very small and they think it is a very big problem, that is another red flag telling us that, uh, when I myself cannot assess, and we over the years have been so tuned to understanding even the minutest of difficulties or problems. If they themselves say that it's, and then you're like, oh, I find it very difficult to kind of recognize it. That is another red flag in terms of, understanding. Uh, so this is what I tell. This is why before we talk about the surgery itself, we take about 5 to 10 minutes to just talk about the patient, their family, their life, their profession, their personal life, maybe their habits, where they are in their life. And at the end, after we talk about the procedure, we tell them, when you're coming to for a procedure, you should be in a happy space. You should be in a space that you're able to endure a certain amount of pain, because that itself takes a certain amount of energy. And if you're already down, it will take you more down.
Yeah.
So, which is
Okay.
why we have to make sure that these people are this. Maybe you can shed some light on how to kind of also before any procedure. Now we know that most of the patients who undergo the procedure are screened by me, and I know for a fact that they don't have any red flags. They're fine. But at the same time, everyone who undergoes anything in life will have a certain amount of anxiety that happens before the procedure. So, is there any way that we can, anything that we can tell them to do the day before, or a couple of days before the procedure, which can help them to a certain extent? I understand, making them completely confident also is not required, but at least allaying a certain amount of anxiety so that the night before they can sleep well at least. Maybe you can shed some light
Yeah.
on that.
So exactly that you were telling about if someone comes, what is a red flag for you is that someone comes saying because of the relationship I want to change how I look. Now that itself is something we still need to take that also seriously from this side, from the psychological side of it, because they're probably going through some interpersonal issues, or they are going through low self-esteem, and that needs to be treated more than actually making a change on their body. So that is when I think it becomes important to refer to a psychologist or a psychiatrist, because if not just that, even after you tell them that for this reason we will not be able to do it, or it's not recommended, that also may have a psychological impact on them. They may not take it as practically as we would trying to explain to them. So that also becomes a concern, and it is very important to address those issues, because that maybe from that we will find out what are the other problems that they're facing, you know, and any other pre-morbid levels of functioning and how they have been, before this as well. And apart from that, the other red flags that you have mentioned, the other red flags from our side would probably be, as I said, body dysmorphic symptoms. One, depression, anxiety. Although you cannot say that you cannot go through a surgery, but we need to be a little careful that they're taking the decision, not taking the decision very lightly, or the judgment is intact. Preferably not, it would not be suggested to do it during the episode of depression or anxiety, because in case it's depression, then we know that, okay, sometimes the perception about themselves and the world changes during the time of depression. So once that is treated, probably they will not really want the surgery, then probably the perception will improve. And also, even if while having the depression, and if they do go ahead with the surgery, it's not necessary that they will actually feel okay after that, because there are other factors also when it comes to depression. It is not just that one issue that they're having. It's also about their whole their behavior, their whole existence, and how they are contributing to other people. So a lot of other factors are very important to assess right before it. And what are the important things that we have to look into right before is, yes, exactly. So whatever you told now was more was like all these clues that we pick up to see, okay, you know, we have to avoid or we have to go ahead with the elective surgery. The other, what we can do is more like a psychological assessment. One was is probably to first to see how they are, because there are a lot of personality also issue that can come up during interviewing a patient, and there are various personality disorders as well, which needs to be addressed. So we have to see how their personality generally is. Are they very sensitive to criticism, or they get very triggered easily by rejection? Uh, so these things become very important to assess. Then after that, yes, obviously we have to see if they're going through any major disorder level of anxiety, depression. Then we have to also see how they would cope after the surgery. Now, immediately after the surgery, Dr. Karan, I'm sure this would happen when the recovery would take some time for few, if I'm not wrong. Is it so?
You're right. You're right.
No. I mean, would the recovery take a little bit of time sometimes for a few patients?
Absolutely. Absolutely. It can
Yeah,
take from a week to about 3 weeks.
exactly. So again, as you said, before the surgery, when you have to do an assessment and give them the reality check, it's more like even during the recovery period can be stressful for them. So it's important to give them the support during that time. About it will take some time, and all of those things, because they would maybe have that expectation that, okay, immediately after surgery I'll be transformed. It will take a little bit of time, is something we, and during the recovery itself, even though they know that it's going to take some time, the whole the pain or the change that they've had, it can be a little difficult for them. And after that, I think we have to what I really recommend is to see the difference in the quality of life with a proper questionnaire, to actually see in what domains their quality of life has improved. So that, we also have the kind of a definite proof that we have been able to make a difference for the patient or the client. So I
Absolutely. I mean,
think
that is something that we
we should
haven't.
make that a routine thing, to during follow-ups or something like that.
Yep. So, I mean, there's also this thing that, there's, like you said, in the post-op period, a
Mm,
lot of them, there is physical tiredness, which uh, goes on to mental tiredness. And that
exactly.
expectation of recovery, which is why we always talk about the time of recovery and the kind of recovery. We are extremely transparent about what exactly is going to happen to you after the procedure, because if you try and sugarcoat that part, then they kind of think that maybe I'm not recovering well, or maybe it's me and everyone else recovers faster. So there are multiple
Yeah.
things that can go wrong if you do not explain to them exactly, or anyone. I think that has nothing to do uh, with people who have a mental disorder, but generally with everyone. We have to be transparent about what exactly they are going to, because sugarcoating the recovery period is the worst thing you can do, because
Yeah.
then they think that, oh, this is taking too long. And some of them, I mean, most of them, we also, that is why the kind of work they do is very important, because working from home, working from a computer, working from having a job like ours, it's very different. So if you have a job like ours, where you're talking to patients front facing, our recovery will be different from a person who can work from home on their computer within the next 2 or 3 days. So, which is why some people get a lot of anxiety. When am I going to go back to work? When am I going to go back to work? Which is why we tell them specifically before the procedure itself that if you are a person who's working from home, then you can take X number of holidays and then you can start working on your computer. If you're in jobs which require to physically be there. We have to tell them exactly how many days it will take for you to get back to work. So the well-being after the procedure, in terms of, also like you said, is there a questionnaire that we can formulate to kind of understand their well-being after the procedure? Like how can has cosmetic surgery improved your mental health? That is a questionnaire that we can go ahead and formulate, because there is nothing which objectively tells us that things have improved. They will tell you
Hmm.
that they have reduced anxiety, reduced social phobias, better self-esteem, maybe better life satisfaction, but it's very difficult to quantify that. Also, where we how we choose our patients, that is another way of doing things. That a patient has a specific problem. If they have a
Hmm.
specific problem with realistic expectations, we know that this person is going to be happy after the procedure, and that will help in reduced social phobias, reduced anxiety. A lot of people go through, I mean, we have people go through multiple things, not from themselves, from their external surroundings. Like parents, while growing up, will say, "You have such a flat nose. I don't have a flat nose." I mean, the parents don't have a flat nose or a
Hmm.
chubby nose or something. Your chin is not good, or usually it's the nose in Indian parents. They say the nose is not nice, even though the parents might say they have a nice nose. So that kind of instills trauma over a long period of time. Then again, you have the relative saying that you put on so much weight, you become fat. I mean, Indian families never skimp on complimenting you, so they'll always say directly on your face, "You put on weight, you've done this." Maybe some women, if they have large breasts, are not happy to go to the gym, because when they go on the treadmill, they are extremely embarrassed by what is happening. So they might put on weight because of that. So when you're undergoing specific problems like this, and then that specific problem is fixed, then you know for a fact this person is going to be happy, because that long standing social phobia associated with it will be reduced.
Yeah.
Whereas a person, like you said, with body dysmorphia, it's very difficult to kind of
Yeah.
make them happy. Now, if a person has always thought of their nose their entire life, you improve their nose, yes, then there's definitely going to be improvement in self-esteem, in this one. One more thing, like gynecomastia in men, which is called man boobs. That is something which gives men a lot of, makes them underconfident. They are not able
Yeah.
to, they want to swim, but they don't have a chance because they don't want to take their shirts off. uh, Maybe wearing t-shirts is a difficulty because they feel like it will be seen. So these specific problems, so the link between improving certain phobias and cosmetic surgery for specific things, and there are studies on this which say that yes, if you have a specific problem and you improve that with a procedure, yes, your mental health will improve. Does that make
Okay.
sense?
Yeah, yeah, it does. It does. So, before we close the session, because we're more than 30 minutes, but I just want to ask you, I'm very curious to know, after the procedure, have you had a lot of, not a lot, but like, have you had patients who said that, no, I'm not happy, I want to do another reconstruction, or they felt like, no, I took a wrong decision, I should not have done that, or something, anything like that? Has that happened in your experience?
So till now, I think we've not had an experience because of the, like I said, the barriers that I have in understanding their mental health. Till now, we've not had a person who has said outrightly that they have not liked it
Hmm.
after the procedure, because we have not chosen those kind of people. If we choose those kind of people, then the chances of them saying that to us is very high. But having said that, there are some things like, especially with a nose job or a rhinoplasty, you have seen your face all your life. You know, they know that the nose isn't as good as it should be. We know that the nose isn't as good as it should be. Sometimes, when that first time we remove the plasters and they see the nose, it takes them a good 1 week to kind of get used to that nose. Till now, the mental image of their face in their brain was a certain way. Now it's changed. So usually they take about a week to 10 days to kind of get used to that new nose. And after a month, they come back to me and say, and say, I love the nose, I love my face. But then that first 2 weeks of apprehension is there. After we remove the plaster, they're like, oh, did I make the right decision in doing this? Because I kind of feel like I do look different. Uh, so that is also something that we specify after uh, during our consultations for say, certain procedures, where we say that we'll remove all the plasters. Just keep in mind that you might not like it the first 2 weeks, even though you specifically said that you want it, even though I think you needed it, and I assess that you're fine mentally. But even then, you have to tell them that maybe it'll take you about 2 to 3 weeks to kind of mentally get ready with that this one. So I think that's the only time it happens. But otherwise, if you are doing surgeries on someone you shouldn't be doing on, then obviously you're going to have problems. So I don't think we have had unhappy problems. But like I said, we have what I learned from this interaction is that a lot of times I might have said no to the procedure, and like you said, it might have come off. Uh, we try to do it as diplomatically as possible, but it might have come off in a way that the patient might think, oh, maybe I have a problem. Maybe instead of that, we should put it in such a way that maybe we can send them to you where you can talk to them, assess them a little better, and then and then if you think that okay, you can go ahead with it, then you can give me an opinion back, saying that, yes,
Either that, or maybe you can actually help them on the lines of the reasons why you prefer not to do the surgery on them. So both.
yes, yes, absolutely, absolutely. That is something that is not talked about, and I mean, I understand it's Mental Health Day. There are huge gamuts of mental health that we have to this, but there is a close association between cosmetic surgery and mental health. I don't think a person who has had a appendectomy done, we don't think about mental health with them too much. Appendicectomy or a gallbladder removal, you're not going to think is this guy's mental health all right? You're like, you needed it, you had to do it. Whereas procedures which are electives, especially in the younger age group, even electives like orthopedic surgery, where they do a knee replacement, usually they are patients who are in the older age group. They are 50s or 60s. They are a little more set in their ways and they're able to cope up better. Whereas we are able to see uh, patients who are as young as 16, 17, 18 to the entire spectrum of 65 to 70. So we should be able to gauge that it is a it's very important. That is why we wanted to have this uh, session today, because we give a lot of importance to where the person is in their mind and in their life before we do the process. We are okay with not doing something, but we don't want to do something on someone that where they're not prepared mentally to kind of undergo that procedure, even if they want to.
There's
So,
another thing is that after a traumatic injury or after an accident, after that, when you have to do a reconstruction or probably plastic surgery, the change itself can be so difficult for them. The even though it's basically like getting the plastic surgery without them actually having signed up for it. The change of their appearance, you know
Yep.
that and what it was earlier. That itself again, that is where we need to collaborate more, and importantly, because to help them cope with that change in life and help them give support.
Yes. And trauma, burns, burns is another
Yeah,
area that we do, and it's another very important part of psychology. And I think as we do more and more of all these, we have to put mental health at the forefront of medicine, rather than yourself
exactly.
that it is not kept on the pedestal or given the same amount of
Yeah,
this as say a neurosurgeon or this one. So we have to give it the equal amount of importance, which is why I think now, I think with Inspiron and with multiple lists, they are able to reach reach everyone, and I think people are becoming more conscious about their mental health now.
yeah, exactly. So I'm glad we have a World Mental Health Day to be able to help.
Yeah. I'm so glad. That's why I was like, whatever happens, I'm not big on Instagram live, but then I'm like, today I think we should do something to at least talk. I mean, even if one person who eventually uh, wanted this sees it and
Yeah,
it helps, right? And then
even one.
live like this will always be on our Instagram, so they can always see it in the future,
Okay,
right?
so I think we've had a good talk, chat. We have a question. How to deal with the situation where I'm physically okay with the surgery but mentally not sure? So I think that would be a red flag, right?
I mean, um,
Mentally not sure. I mean,
yeah, yeah.
it
I mean,
you would,
you have to be sure about it.
yeah,
Physically, 99% of the people who come to us are physically okay
correct.
with a surgery. Um, Mentally, you have to be you have to mentally say yes to the procedure. Otherwise, you're not going to even come to us. If
Yeah,
you're physically and mentally saying yes, but then are you physically and mentally fit is something that we assess. Correct?
yeah,
So I think you have to take the step. And one more thing I always talk about um, is trust. You know, uh, it is important to trust. It's important to research who you're going to, and it's important to, once you research, have faith and trust that person who you're doing anything with. It can
yeah,
be if you start going for counseling to someone, have the faith in them to, because you've researched it. Don't shop with multiple people and then say, this is who I like.
hmm,
Rather, do your research and then maybe go to one or two people and then decide what you want to do. Rather than you getting confused with 10 people and then you're like, no, I can't make a decision.
yeah.
So that
Agreed.
is something, yeah. That is one more thing. So research and trust is important. Cool. I
So
think
we had really,
we've had a fun talk. This was
yeah,
nice.
it was so nice chatting with you, Dr. Karan.
You're welcome. Likewise, and I hope we'll see each other more often.
Yes.
Um, I think good. I think we wanted it to be around 30 minutes. We did it for about 40 minutes, which is pretty nice. Which means
Yeah.
we liked it.
Yeah.
Yeah.
So I hope we're
Other.
able to bridge that gap.
Yep. Yep.
So,
I hope so. I hope so too. And if people have questions, they can always ask us or Inspiron
yes,
directly,
yes.
and
Please
we are more than
send
happy.
out your queries or questions on Insta.
Yep.
Thank you all
Yep. Yep.
for joining today.
Thank you. Thank you, everyone. Thank you, Bhuvana. All right.
Take care.
Bye. Thanks.
Bye.